In today's video, we'll discuss about psychiatrical pemphigoid. Now, what is psychiatrical pemphigoid? It is actually an autoimmune blistering disorder or a disease that predominantly affects the mucous membrane, including mouth, oropharynx, conjunctiva, genitalia, and nares. Now, other names, it is also called as benign mucous membranous pemphigoid. Also, one characteristic name is ocular pemphigoid. We will come to know why is it called as ocular pemphigoid, because it is some manifestations that pertain to ocular uh, system. Now, it also, however, it also shows a cutaneous involvement such that it causes blisters, tiny blisters, and erosions on head and neck or site of trauma. Now coming on to the etiology. In etiology, why it occurs is it occurs basically it is an autoimmune blistering disease. So it is very obvious that it will occur due to the autoantibodies. Now autoantibodies against bullous pemphigoid antigen 2, bullous pemphigoid antigen 180, also laminin 5, which is also called as epiligrin. Okay. Now coming on to epidemiology, it occurs in people who are more than 40 years of age and it shows a female predilection. Also coming on to the location, it can be oral, it can be ocular, skin, skin also of basically genitalia or near body orifices. Now let's discuss about the eye lesions. These are very characteristic and you must remember them with the keywords that I will be telling you. So first of all, initially what happens is conjunctivitis. So initial conjunctivitis. Then what happens is there occurs the adhesion. Adhesion develops between palpebral and conjunctival, palpebral and bulbal conjunctiva. Now this leads to a condition called as symbol Ferron. Okay. Now you have to remember all these keywords. These are really important to mention. Now in third, what you will see is there will be obliteration of the palpebral fissure plus opacity of cornea. Now if there will be opacity of cornea, the person won't be able to see. So that is there will be blindness. Then there can occur corneal ulceration. Also remember that if there is ulceration, so it will also be accompanied by blister formation, right? And then there are many more things which you need to remember, such as can occur the fibrosis and scarring of lacrimal ducts. Now due to this what will occur is the person he will have a dry eye. Then there can be scarring of conjunctiva, conjunctival mucosa, due to which the eyelids will turn inward, which will lead to a condition called as entropion. Okay. Then another one in which we will see that the eyelashes turn inward and rub against cornea. So this condition is called as trichiasis. Then swelling of fornix and corneal opacity. Now let's discuss about the oral manifestations. Now in this, what you will see is, you will see thick walled vesicle bullous lesions that persist for 24 hours before rupturing and desquamating. All right. Then what we will see is, when they rupture and they leave a raw, eroded, bleeding surface. Now, one thing that you must remember here, and it is very important, uh, most of the consistent lesions, they occur in gingiva. Also, it will have persistent erythema even months after the lesion has resolved. In advanced cases, what you will see is oropharynx is involved. Now, due to this oropharynx being involved, what you will see is progressive esophageal bleeding or stenosis, further hoarseness of voice, plus inability to eat, that is dysphagia. Now let's talk about the histopath. In histopath, first of all, you have to mention about the subepithelial, basically intraepithelial split, then subepidermal vesicles. No acantholysis is seen. Also in this, Nikolsky sign is very strongly positive. After histopath, you will also see some chronic inflammatory cell infiltrate, consisting of lymphocytes, plasma cells, and eosinophils. Now, in differential diagnosis, you can mention about the bulloid, bullous pemphigoid, pemphigoid, pemphigus. All right. In treatment, basically, we will have to give minimal doses. Okay. So first of all, we need to resolve the lesion. Basically, corticosteroids and antibiotic prophylaxis is given. So this completes the psychiatrical pemphigoid. I hope you understood. Uh, Only it is very important because of the eye lesions. So thanks for watching.